One of the biggest gaps in fertility world I found was only a small fraction of what you take orally actually reaches your bloodstream. You will have much higher concentrations of progesterone exactly where you need them, in the uterine tissue. If you've been prescribed oral progesterone and still not getting pregnant, there is a reason for that. Did you know that not all progesterone supplements work the same way? In this video, I'll break down how the form of progesterone you use can make or break your fertility journey. I'm Alina Klimov. I'm a nurse practitioner and an Institute of Functional Medicine certified provider. 8 years ago, I was just like many of you, at my wit's end, trying to figure out why I can't get pregnant despite doing everything right. I was lucky to have medical background that allowed me to dig deep and truly understand through PubMed articles, physiology, and fertility research what conventional medicine gets right and what it completely misses. And trust me, it misses a lot, and often the most basic things. But not everyone like me going through infertility has medical background. Most women have to rely on their doctor's advice like it's the word of God. But the reality is, medicine often reflects the opinion of the provider you're seeing, shaped by the level of knowledge, personal experience, and sometimes even anecdotal evidence. I personally understood that in order for me to get pregnant, I couldn't solely rely on the advice of my medical provider. If I did, I wouldn't have my children today. I researched, looked into second and third opinions, and asked my medical provider to change my fertility plan despite his beliefs. I had to become a seer of my health and change the narrative of my fertility story. And that is exactly why I created this channel, to share no BS fertility advice, so you can learn about your options, separate myth from truth, understand the cutting-edge research, and apply evidence-based medicine from both conventional and functional perspectives. If you're curious to learn about functional medicine and my personal fertility story, check out those links above. If you look in the description section, you will find links to current research from both conventional and functional medicine worlds. One of the biggest gaps in fertility world I found was in how we, medical providers, supplement progesterone. Most OBGYNs and fertility specialists prescribe oral micronized progesterone, often known as Prometrium. It's easy to take, it's FDA approved, and it's labeled as bioidentical. But here's the truth that most women don't know about. Oral progesterone is not the most effective way to support the uterine lining or sustain early pregnancy. Let me explain you why. Progesterone's main job after ovulation is to prepare and stabilize the uterine lining so an embryo can implant and thrive. But when you swallow progesterone, it travels through your digestive tract and gets broken down by your liver, a process called first-pass metabolism. That means that only a small fraction of what you take orally actually reaches your bloodstream, and even less reaches your uterus. That's why many women feel sleepy after taking progesterone due to its metabolized acting on the brain, but still struggle with low uterine progesterone levels. So yes, oral progesterone can calm your mind, but it rarely calms your uterus. Oral progesterone is excellent for my perimenopausal patients who struggle with insomnia and anxiety, but not so much for patients who are trying to support pregnancy. Now let's talk about vaginal progesterone. It can be used as suppositories, capsules, or gels. This method of administration bypasses the liver and delivers progesterone directly to the uterus through the first uterine pass effect. That means you will have much higher concentrations of progesterone exactly where you need them, in the uterine tissue. In fact, studies show that even when blood levels appear similar, vaginal administration achieves superior local saturation of endometrium compared to oral forms. However, it's important, vaginal progesterone isn't perfect either, because it alters vaginal environment. Some women experience discharge or even yeast infections that drive them absolutely crazy. This happens because progesterone can change the vaginal microbiome, and we know exactly how healthy microbiome is critical for implantation and early pregnancy success. So if you're using vaginal progesterone and notice irritation and infection, don't ignore it. It's your body's way of signaling imbalance. And now we're going to talk about intramuscular progesterone, the gold standard, the classic oil-based shots many IVF patients know too well. IM injections provide the most consistent and predictable uterine tissue saturation, and that's why it's the gold standard in IVF protocols. But let's be honest, it is not fun. I've experienced those injections firsthand and still remember to this day the knots and pain from those shots that I had to give myself. I could barely walk for days. Those injections can be very, very painful, sometimes leaving bruises, lumps, soreness for days. That's why they typically reverse for IVF or high-risk pregnancies. If you're currently doing those progesterone IM shots, or will be soon, I actually have a separate video where I share practical tips to how to make those dreadful progesterone injections much less painful. So definitely check that one out. If you've been pregnant and been diagnosed with low progesterone and you've been trying oral, vaginal, or injectable progesterone to sustain pregnancy and it's just not helping, the real question becomes, why is your body not making enough of progesterone on its own? Now, here's where functional medicine comes in. We'll look at the deeper factors like stress and cortisol, which can block progesterone production. We'll look at thyroid dysfunction, which can shorten the luteal phase. We'll look at inflammation and poor gut health, which can alter hormone metabolism. And we'll also look at nutrient deficiencies like B6, magnesium, or zinc that are essential for ovulation and hormone synthesis. When we uncover and correct the root causes, your body naturally starts producing progesterone at the right time and in the right amount. So if you've been relying on oral progesterone and it hasn't worked, it's not your fault. It's about understanding the science behind how your body absorbs and uses hormones. Vaginal progesterone gets closer to the target, but can affect your microbiome. Intramuscular progesterone delivers the most reliable results, but often at the cost of comfort. And ultimately, the best outcome happens when your body can make progesterone naturally through balanced ovulation and whole body health. If this resonated with you, make sure to subscribe to my channel. I share weekly, no BS fertility education that blends functional and conventional medicine so you can finally get to the root cause of your fertility story. And if you want personalized guidance, I work with patients online and in person in the Woodlands, Texas. You can find all the details in the description below. Fertility shouldn't be about protocols. It's about physiology, individuality, and empowerment. And you deserve care that honors all three.